Now, I'll admit I'm not the biggest fan of Ford because of all the policies that he's implemented that have cut a lot of the spending that has went into social services. But I have to say that his administration has been doing a very good job with how they've been handling the pandemic so far. For example, they've implemented a new provincial emergency order that's going to make it easier to provide care for those who are deaf and blind. So what I mean by this is that providers and employers in that sector are going to be able to assist people who suffer from both hearing and visual loss, and they're going to be given temporary authority to redirect staff to carry out essential support tasks. Ford is also providing 21,100 iPads with wireless data, by the way, to low-income students to help them continue with online school. And recently, they just rolled out the Ontario, Canada Emergency Commercial Rent Assistance Program. And what this does is it's going to make the owners reduce the rent owned by their small business tenants by at least 75% for April till June. And there's also going to be a 3-month moratorium on evictions, which is also a very important thing as well. And what I also like about what Ford has been doing is that his government, they're not trying to rush to reopen the economy. Like, I like how they're trying to develop a measured approach, and they're not putting any hard deadlines on when they're going to reopen stuff. But unfortunately, some of his conservative counterparts in the United States, they've really taken their mask off and show that they don't care about their people. Like, for example, the Georgia Governor Brian Kemp, he allowed businesses in his state such as nail salons, gyms, tanning salons, and tattoo parlors to reopen on Friday, April 24th. And honestly, man, like, I don't see why you would do something so foolish, because like I think people can wait a few more months to do their nails and their perms. What do I know? But anyways, back to Ford. His administration recently said that they would be providing 350,000 frontline workers with a temporary pandemic pay raise amid the outbreak. So these workers, they're going to earn $4 per hour extra on top of existing wages. Employees working over 100 hours per month will also receive a lump sum payment of $250 per month. And this is going to be over the course of 4 months, mind you. So what this means is that eligible employees working an average of 40 hours per week, they're going to get a total of $3,560 in extra wages. And the workers that are going to benefit from this hazard pay, they include long-term care homes, retirement homes, emergency shelters, supportive housing, social services, congregate care settings, corrections institutions, youth justice facilities, some staff in hospitals. Boy, this is a lot. Even registered nurses and auxiliary staff. And their pay raise is going to be effective until August 13th. So obviously that's a very good thing, because these people are heroes, right? They're on the front lines. As we know, like, our healthcare system has been compromised because shortages of PPE and things of that nature. Also, like, some areas haven't been able to like implement social distancing policies effectively, as I'm going to discuss later. So that was a very, very good step in the right direction by the government. I commend them for doing that. However, there are a few issues that I have with the legislation. So, as you may have noticed, paramedics, midwives, and respiratory therapists were not included in this hazard pay legislation. And I'm very surprised to see that, because they're very important too. Like, people are still having babies right now, like, this is a respiratory issue that we're dealing with right now. And like, paramedics, that's like the definition of frontline staff. Like, even with the paramedic situation, that was really troubling to me, because first of all, they're being disregarded, right? Like, paramedics, like, I don't think many of us understand like just how much goes into that line of work. And like, mind you, paramedics like are even spending their time in long-term care homes, hospitals, and shelters helping patients. And as we all know by now, this disease has really spread like a wildfire through the long-term care homes. Like, for example, already 463 residents have already died, and the military has even been deployed to 5 long-term care centers. And this is just to deal with like the staff shortage and things of that nature. And also, in shelters, they have their own issues as well, because there's even reports of them like not even following the strict physical distancing rules. Like at least in Toronto, apparently the city ordered shelters to place beds at a distance of 0.75 meters apart. And obviously, as you know, this goes against the 2 meter distance that the health officials have ordered. So there's a problem within and of itself, because in a shelter, these are people that don't have anything, and like that don't have anything, and then like they're being in such close quarters with each other. That's a problem. So the fact that paramedics are gonna add even more like hazards into their line of work, like it really is a slap in the face that they're not getting paid. So I'd really like to see like the workers that I just mentioned be included into this legislation, because they're all important. Like it's just like it's kind of disrespectful, like you include all these important workers, but then there's still these other groups of employees that are just not getting anything. Like it's just, I hope that they correct that in the legislation. And also, even Ontario NDP leader Andrea Horwath, she was saying that the additional pay should be retroactive to the day that the province declared a state of emergency on March 17th. And mind you, at this point, there were 189 cases in Ontario at that stage. So I agree with her as well. Like I think it really should be retroactive, because even back in March, like it wasn't like it was already like well established that it was a problem. So I think that they should be compensated for that time as well too. So yeah, that's all I really gotta say today. I hope that the Ford government adds those other workers into the legislation. And yeah, guys, continue to stay safe, and thank you for watching.